Uh, Great.
Hi, Dr. David. It's so great to see you.
Good to see you too, Tammy. It's been too long. Nice to be here. Thank you for the invitation, and look forward to coming back every couple of months. And as you indicated offline, this is a bit of a different date this time, but normally I'll be on the second Wednesday, and we're going to normally talk about chemsex stuff, which is my specialty. And I'm going to talk about a few things about that this morning. But this webinar is really open to everybody. I'm a CSAT and do a lot of work with the sex addicts and partners as well. And but I have been doing some work, including a conference overseas last couple of months around chemsex, and there's just some interesting things going on that because in what we define by chemsex, by the way, is just it's really sexualized drug use, which means a combination of not only acting out in some way sexually, whether that's just porn or sexual acting out or both, but doing that with drugs of some kind. And typically that's amphetamines, although it can be marijuana, it can be alcohol, it can be really almost anything. And I'm really pleased to say that I'll be releasing a book through Seeking Integrity in the next couple months. It's going to the designer next week, called Sex Under the Influence, which is really all about this idea of sexualized drug use. So do look for that, because we do find it increases. And even with the guys at Seeking Integrity, sometimes they don't really identify as a drug user or alcoholic per se, but when we look at their addiction ritual for their sexual acting out, it often starts with a drink or two or a joint, and they don't drink alcoholically, they're not falling down blackout under the table, but that kicks off the ritual. And so I think we really need to kind of look at the bigger picture sometimes, not just the main acting out behaviors sexually or otherwise, but really maybe there's some other parts and other addictive behaviors around that ritual. The other side, by the way, is after people act out, they often feel shame and remorse. They medicate that too. And so it's with drugs often or alcohol. So it goes together. But in terms of this chemsex behavior, which has been my specialty over like 3 decades, some new things going on. Right now in the US, particularly as opposed to the rest of the world where the chemsex is on fire everywhere. But in the US, we're seeing a dramatic increase in overdose deaths. And this largely is due to the infiltration of fentanyl, which we're all familiar with, into the drug supply of methamphetamine. And as opposed to opioids, where fentanyl struck first, methamphetamine has been a drug supply that really hasn't had that infiltration, and it's getting there now. So we're seeing this dramatic increase of overdose deaths, largely due to the fentanyl, as opposed to the methamphetamine itself. So that's been on the rise in as dramatic a way as it was for opioids a few years ago. And one of my frustrations is that we have 2 drug epidemics in this country, right? We have opioids, but we also have methamphetamine. And especially on the West Coast of the United States, there's far more meth overdoses, meth arrests, meth hospitalizations than opioids. So I think we really need to get our heads around that. The second thing, and this is where it's really disturbing. I've talked to a bunch of providers, both in this country and overseas, is that the methamphetamine that we are seeing on the streets now, which comes almost exclusively in the United States from the Mexican cartels, who produce this really pharmaceutical grade, almost pure, completely pure methamphetamines on the street. It's really strong. But from a therapist point of view, we're seeing a lot of people with psychotic features, psychosis particularly, that's not going away. When I started with this work 30 years ago, typically people would get a little paranoid. They'd hear voices. They'd be suspicious about people on the street, and sometimes more dramatically so. But almost inevitably, after a week or two off the drugs, that would go away. That's not happening now. We're seeing people almost indefinitely on antipsychotic medications, really disturbed, having auditory hallucinations, and continuing to be paranoid and suspicious, and just it's really disturbing because this is not something we saw before. This is kind of the new normal, however, today. So that's a real problem. There are a couple more trends, then I'll open it up. We're seeing people, when I started this work 30 years ago, by the time someone became an injection drug user, it was like I guess we call it the end stage, right? They started out smoking and snorting and had that life, but injecting was like kind of a whole different step beyond, right? That's crossing a line in the sand. And then now I'm seeing increasingly people who are younger starting using meth by injecting. So it's no longer that kind of progression from one thing to the next to that final stage. That's kind of how they're kicking off their drug use. And part of it, I think, is the thrill. Part of it is just the carelessness, the lack of self-esteem. And I know as we know a lot with addictions, there's trauma and other things underneath it. So there's a lot of stuff going on when that happens, but still it's a phenomenon that we're seeing. And then two more things, both related to kind of more sexuality issues. There's, chemsex is not just meth, it's not just other drugs, but one of the main drugs that goes with it is, if you're not in the scene, you probably haven't even heard of it, called gamma hydroxybutyrate, GHB. And GHB is often used by chemsex users to kind of temper the edginess of meth, right? It's a softening kind of drug. The problem with GHB, it's a very close cousin of rohypnol. We know rohypnol, of course, is the date rape drug, and it causes immobility, it causes memory loss, it causes the inability to give compliance or consent for whatever's happening to you sexually. And just like with the problems with rohypnol in the men who have sex with men scene with chemsex and G, we're seeing a staggering increase in the amount of sexual assaults going on. And this is happening overseas, it's happening here. It's happened to clients of ours at Seeking Integrity. It's happened to clients of mine outside of Seeking Integrity. It's just a phenomenon that is really needs to be addressed, because it's causing a lot of shame. People, like every abuse survivor, in this case, these men who have been assaulted by other men think, well, I put myself in that position, I brought it on, and blah, blah, blah. They're victims of sexual assault. And so that's a big issue. And then the final thing that is a really scary trend to me, again, to relate to some of the sexual stuff, we do see an escalation sometimes with sex addiction, where people start to get into more taboo behavior, to have more kinky images, for example, with porn and so on. And sometimes, not frequently, but sometimes we do see people escalating into underage porn. It's just not because necessarily they're pedophiles, but because that's giving them the kick they need of dopamine at that point in their addiction. We are seeing now, after the pandemic, with the chemsex scenes, a vast increase in Zoom rooms, and a lot of really visual behavior going on in these Zoom rooms. A lot of it centers around injecting, which for those of us, I'm not an injection drug user, but it becomes a fetish for people. And just seeing as the act of injecting itself gives them a dopamine high. But what we're seeing, my point here is that we're seeing the infiltration of underage pornography into these chemsex Zoom rooms. And this is a huge topic, because those guys are really, really high. They're in a very vulnerable state, if you will, from an arousal template point of view. These images go in, they kind of can't be unseen. They're in their brain then. And the problem is that we as professionals are really hampered in terms of how we talk about this. And if somebody is straightforward with it, by law in California, at least, I'm required to report them. And how do you bring this up in a group? So I'm talking with some other therapists around the country, kind of, how do we address this? Because this is a big deal that also is a new factor since before the pandemic. So this scene, and I keep thinking it will kind of fizzle out. The chemsex scene, it's going to get easier. It's just getting worse, like a lot of addictive behaviors. So that's kind of a little message from my part of the world here, the sex addiction world, because it's that drug piece, and it's getting pretty dark and scary. Just I thought that's probably news you're not going to get elsewhere. It's a big trend in that theme, so I thought I'd just bring it up. But I am happy to talk about anything people would like to talk about in terms of this field. And I don't know if there's questions or not, Tammy. I didn't.
Not yet, but we would welcome your questions about, particularly, obviously, an expert in the co-occurring chemical and sex, but really, anything. I have a question for you. So on on these Zoom rooms, when you're saying they're injecting, so is it someone's going to watch others inject, or are they all inject? I mean, I have no concept. Like, this is a new thing for me, which is kind of shocking at this point that there's more new stuff.
Yeah, it's basically, we know that from these super stimulants, that includes sex, porn, and amphetamines, right? With men, at least, they become really hypervigilant visually. With the visual, what's called visual memory gets really heightened. And so people become particularly visually sensitive to images. So basically, it's watching other people inject. The act of injecting itself, and you'll hear guys, not just meth users, but any injection drug user, talk about even getting their blood drawn can be a real triggering event, because because of the whole sensation, and they remember how it feels when that drug hits their vein. It's a whole like dopamine high, almost euphoric recall. And so watching it, the people are getting off on just watching other people inject for the most part, which is really, it's a whole kind of fetish in and of itself that almost is removed from actually hooking up with somebody or even, engaging in any kind of sexual behavior. The high is from watching this, the injecting itself, which is a whole dark corner of this world. And I have not seen that myself. I choose not to see that. It's very upsetting to me, but I hear clients talk about it with regularity and this new feature then. And a guy, I was asking somebody last week about it. He said, it kind of is like in the old days. It's not that there's sharing porn and these things necessarily, but like in the early days of the pandemic, when there was Zoom bombing, like recovery group rooms, people do that in these sessions, and they'll kind of pop in, or somebody will mention something that's triggering. So it's a kind of inadvertent, but it happens, and once people see that, then it opens a door into another kind of dark corner that they hadn't gone to before.
Yeah, and I'm thinking it's not inadvertent because somebody's being very intentional about doing that.
It's not
I know
accidental.
it's not inadvertent. Yeah, right. Yeah. So no, I hear you. And you're talking about the psychosis and things, and like one of the things, and this is it's not just my personal opinion. I actually do. It's one of the areas I continue to stay engaged in is, cannabis, because everybody, acts like it's a neutral thing. And, I'm hearing more and more, issues with, psychosis with, cannabis. And, I don't believe that there's, I just like drinking. There are people that can drink or have, use cannabis on a, mild basis. But for those of us who have compulsive behaviors, it's highly problematic. So, it's the different strengths and different grades and all of those. So, you're talking about, the drugs that are mixed and things like that. And, can you elaborate a little bit more on, cannabis? Because, I'm hearing more and more, and we really have more and more guys that are coming to Seeking Integrity that have co-occurring, cannabis use, which everybody's kind of going like, well, I just smoke pot. Well, probably not,
No, exactly. And I think, as somebody who smoked pot before I got sober several decades ago, I don't think the pot, from what I hear, is like the ones we had.
It is not, right. We had baby pot. I always say we had baby pot back.
That was like basically weeds and sticks,
Yeah.
Like I was having a conversation with somebody who runs a standard drug treatment program, talking about this psychosis from meth piece. And she brought up the number of clients they're seeking. They do young adults who are really struggling with cannabis, with just the point you mentioned, Tammy, because of the strength, because of the dosage, because they're getting actually psychotic on cannabis.
Oh, wow.
And everybody, including parents of these young adults, underestimate the power of it. And so I think we really have to recognize this, that it's, you're right. I mean, and those of us that have that, and I'm in recovery too, those are that compulsive behavior, there's a weak link there, right? I don't really want to test the waters. It's like gambling never held any interest for me, but I'm not going to go spend a weekend in Vegas pushing my limits to see, and I think the same thing goes with cannabis. And as it becomes legal, or medical marijuana gets approved in more and more states, it's becoming, and there's been studies of this, the perceived dangerousness of it gets reduced, right? Well, it's legal, it's medicine, it's, we can rationalize it. And for addiction aside, for normal adults, it's not as dangerous as some other drugs. For the adolescent developing brain, however, it's extremely dangerous. It really has impacts in a very deleterious way on the developing brain. But for anybody, the strength of the drug right now, the fact that it's so easily available, it's legal, it's considered, just another like caffeine. So it's really dangerous. And we are seeing more and more people getting sick, getting really psychotic, getting highly addicted to it. So I think it's just something we really recognize. And I think we're doing a disservice to people if we don't continue to kind of raise the alarm about that, because there is this kind of idea it's a natural plant, right? It's cocaine. So yeah, I think we have to really be cautious, because I think there's a lot of people getting in real big trouble with it, because the skills that have gone into breeding these plants that are really powerful are considerable and it's powerful. The other thing I'll mention, and that I think our professional field is kind of torn, is in the microdosing of different kinds of hallucinogens and psilocybin, MDMA, ketamine, and so on as kind of therapeutic tools. And I do believe down the road, perhaps especially MDMA, ecstasy might have a role to play in trauma relief, but I think we're way too soon. I'm being really conservative here. The test is like, would I do that as a recovering person? And no, I wouldn't. And I'd do that based on some clients that we've had who've tried it and really gotten in trouble. They relapsed shortly after trying it. So, and part of that may be the way it was not, the experience was not integrated with a follow-up session and blah, blah, blah. But I just think we don't know enough yet. And I'm very hesitant to endorse any of my clients to do that, although some of them have done it independently and have had a decent experience. But I think just we're on frontiers of a lot of areas in this, and I think we have to really err on the side of caution because it can be disastrous. We all know this one slip can lead to never coming back. So.
Well, and I think we as addicts are always looking for that. That's the quick fix. If I just do this now, I do research. Not like you, but like I pay attention to stuff. And one of the studies that I heard about was, like with ketamine specifically, it's like it helps, but if you stop doing it, it doesn't stay helping. Like you have to continue it. And I was like, okay, so now you're a lifelong ketamine user. And again, this was just one study, and I don't have the information handy, but that was my recollection of that, is like, if you don't continue it, then like you don't have this residual or overarching effect of like, okay, now that's removed the trauma and now I'm okay. It's like you have to keep doing it. So I was like, okay, so it feels like you get some relief, and and there may be some legitimate cases where it absolutely can help. I don't know, but it would be like, now I'm signing up to consistently be, on this program, so to speak, in order to have any kind of lasting, benefit. I wanted to talk to you about, because you talked about caffeine, and I was like, I mean, alcohol, I think we talked about baby pot, but the alcohol, like beer used to be, a certain percentage, and now it's like twice or, more, as alcohol content. And now they're adding, stimulants with it, with a mix. And I'm hearing some really negative effects of that. Do you have any information on, those kind of, I think it feels like what you're talking about with the GHB, I want to temper this. And so if I use the alcohol, it'll be depressing. But if I add caffeine to it, then, I'm doing this concoction to try to manage it.
Right. Which really is like addiction in a microcosm, right? Because I used to do that myself.
I did too.
The perfect combination of, to sustain it and get high enough and blah, blah, blah. So yeah, I'm seeing that. And again, I think the real risk population is younger people right now, both adolescents and young adults who are using these energy drinks that are combined, not just with a high-powered caffeinated content, but other kinds of things, sometimes alcohol too, in these drinks. And there's been studies of this, just like with cigarettes and nicotine 20 years ago, when they were really marketing to certain populations with colorful labels and fancy names and cute pictures and stuff like that. And the same thing is happening in the branding of these alcoholic drinks that are spiked with unbelievably high amounts of caffeine and so or other stimulants. And so it's a big problem, and they become part of people's normal routines, right? Work days, even in people who are interested in their health, people that go to the gym, people that work out, then they'll follow up with one of these drinks. It just, it's a problem for me, but we're seeing this totally, and the marketing, it still exists. Those drinks are really meant to appeal to a certain population, a certain demographic, and they do. But I think the amount of alcohol and caffeine is staggering in these drugs that we see, for sure.
Well, and and on some level, do I like my coffee? Yes, I have a couple cups of coffee in the morning, but it's like anything that we are using, that is, that has a chemical reaction, so to speak, with us, I think being an informed consumer is really important, and I limit myself to 2 cups of coffee a day because, I was having more and that was not really working for me, so,
Me too.
yeah. So like understanding, the cost benefit, thing, but go ahead.
I was just saying you nailed it because you said, as addicts, we look to things outside ourselves to make it right, right? And
Hmm.
that's the easy fix, right? That's the easy way. And I think that instinct is strong and stays with us sometimes. I think we have to, consciously remember that when we're feeling uncomfortable. And we talk this with our sex addicts all the time about, managing, learning how to manage uncomfortable emotions and sit with them. And so to be bored is the common
Hmm.
one. Have nothing to do or have little to do or have a quiet space for the next hour. That can be really challenging to a lot of addicts, especially sex addicts and intensity addicts.
Hmm.
Um, learn with fear or any kind of feeling. Sometimes if we can't resolve it right away, we have to. And sometimes life, it's not always easy answers that are black and white. We have to sit with stuff that are uncertain for a while. That kind of distress tolerance is a skill. It's like a muscle to build up, and it's a really important one because otherwise, as soon as we get uncomfortable, we're looking somewhere for a fix to make it better, right? And by making it better, I mean just basically numb that feeling, numb our experience of that feeling, so we're not experiencing it. And for the sex and porn addict, that means drop into that bubble we talk about. And the problem with sex and porn, of course, it's so available and private and convenient and easy to get on your phone and everywhere else. So it's really pervasive from that point of view. So to teach people to, first of all, recognize what they're doing, that, yeah, I'm uncomfortable inside. Maybe the solution is also inside, right? Not getting something from the outside to fix it or distract ourselves or numb it or disconnect from it somehow. But that's really important point, just to really remember we need to develop the resources ourselves. And I think, certainly speaking as an addict, I don't know how this happens, but there's a lot of life lessons, life skills I never got. And I've had to really learn those in recovery, the basic stuff, right? That you'd think, well, how did I miss that? But I didn't. And so never too late, but we just have to be conscious.
Well,
It's a
I,
consciousness.
I I use the analogy. I didn't get the owner's manual like when I was born, and so like
Right.
thank goodness the recovery tools, and the 12-step programs and all of that did give me the tools to use, and people gave me support. We have a question, and this is one of my favorite topics when you talk about this. So, can cigarette smoking hinder an SA or PA's recovery, and how? And I would like you to talk about smoking and vaping, and not just about SA PA. I mean, like how you've shared, so how problematic, so Seeking Integrity is a non-smoke, non-vape facility, and there's a reason. So elaborate, please.
Yeah, thanks, Tammy. And a great question. Right. And we are a non-smoking, non-vaping facility, which is, believe it or not, unusual among a lot of treatment centers, whether they're for drugs and alcohol or sex addiction in the country. And we do that very intentionally because we know from studies that nicotine is, of course, an amphetamine. It's a stimulant that actually, when you look at the scales, nicotine throws out more dopamine than an orgasm. It's a strong, strong drug and a very rewarding drug. It's why it's so hard to quit. I'm an ex-smoker, and I can tell you it's a hard one. I tried to quit several times before it stuck because it's such a powerful drug. But it's more of an insidious drug. The way it works in the brain, it gets, to simplify it, it gets double metabolized by the addiction center of the brain. So that although it's a certain amount of nicotine per se, it has like double the kick. And what it does functionally is really keep the brain in kind of addictive idle mode, so that nicotine kind of teaches the brain in a very effective way how to respond to addictive stimuli. And it's I don't have a good metaphor, or analogy, but the one that comes to mind are the cars that would kind of be on, and you don't even realize it because they stopped. They're idle, but you have to kind of push the button to turn it off. In a way that our our brains are like that when we're giving up all these other addictive substances and behaviors, but when we continue to smoke nicotine, the brain is still kind of in active idle mode, waiting for the next addictive event. And so by giving up nicotine, it really helps totally kind of cool off the brain and detox the brain from all those addictive stimuli, and kind of lets that quiet down. And I think it's just really important, because otherwise we're just doing a disservice to clients by keeping a very relatively active addiction in their brain. Now, the people inevitably ask, well, what about caffeine? As we were just talking about, and caffeine is a stimulant also, of course. The one thing about caffeine, it's metabolized in a different way, in a different system, and so it doesn't have this direct impact on the addictive process. Like, nicotine is kind of a little junior methamphetamine, if you will. Caffeine's in a different category. Now, both Tammy and I limit our caffeine intake because I just don't like the way I feel if I have too much caffeine, and that's not beneficial for anybody. So I continue to drink caffeine, but I put in a different category. I don't continue to smoke anymore. I think it's just a bad idea for somebody trying to stay clean and sober. So yeah, it's a great question, and I think one that I wish more centers would take into advisement, because I do think they're doing a disservice to their clients.
Yeah, and I think they're doing I'm not going to fight them on that. We really need to address the alcohol or whatever it is. And I'm like, but you shared before, and I hope I'm still quoting you correctly. You're like 9 times more likely to relapse if you're smoking or vaping, because, it keeps that, you talked about the idle, it keeps the dopamine, kind of just humming there, and I think with smoking, one of the things is it's so tied to, like, I mean, lots of people, have a cup of coffee and have a cigarette, have dinner, have a cigarette, so there's part of the habitual, with it too. So it's, but it really does, oh, I calm down when I have a cigarette. Yes, because it's, I've got this little routine I'm doing and all of that. And again, just like you're talking about it, like if we don't have the emotional bandwidth, if we're not, dealing with life on life's terms, it's a really comfortable thing to do. I'm just going to go do this, and then I'll feel better, and we're looking for that magical thing that makes us feel better. The problem when we numb out the bad feelings, we also numb out the good feelings. Like, we're not, intensity is not joy and contentment. Intensity is up here, and joy and contentment is, regardless of what life is doing, you can have joy and contentment, even in life's struggles. I learned that.
And it's the truth. And I'll put it in terms of neurobiology in a simplistic way. The high that sex addicts and porn addicts and chemsex addicts get, and it's all the same, is mostly from the amphetamine. It's about dopamine and adrenaline, right? It's fight or flight. Literally, it's fight or flight. It's like that mood when we're in life-threatening danger, our heart's racing, our eyes are big. That's the thrill of a sex addict. Which is unsustainable, by the way. We're supposed to be in fight or flight for a couple of minutes to get us out of danger. But what you're talking about, Tammy, that's intensity. But you're talking about joy and this much broader feeling, which is not just dopamine and maybe some adrenaline, but it's a serotonin, norepinephrine, all these other neurochemicals that give a much more rounded experience, where we can feel grounded and loving and secure and also intense. But it's not just that hard edge intensity that you see from just emphasizing the dopamine part of the equation. So I think, and that's when we talk about outer circle behaviors, where people are doing healing behaviors. What are those doing? Those are, some of them can be intense, I guess, but really it's designed to give people a much broader experience, an emotional experience of feeling all those other chemicals as well, including, by the way, oxytocin, that bonding hormone that we talk about a lot, that really helps us come together as human beings and form those friendship and love bonds. But I think all those kind of get excluded when we're talking about these very specific dopamine seeking behaviors, because it's all about the intensity and nothing else. And consequently, a lot of sex addicts, and I think sometimes partners, confuse intensity for intimacy, right? And intimacy is a much broader thing with a lot of different subsets of skills than just feeling a lot of intense dopamine from that point of view.
But you can see why it's a hard sell for, somebody who's used to experiencing these intense things to go, oh yeah, you're going to have joy, like that sounds boring, it's challenge. I get it when people are like, oh, you're telling me I'll never feel like that again? And the reality is, like you said, it's an abnormal, you can't experience that intensity in real life. So yeah, it is, it is a calmer version. And if you're so used to this, now I also know, you can blow up your dopamine receptors so that they don't, so you're seeking something, but you won't get it
Exactly.
because your body doesn't function that way anymore. So,
And you know, and the real truth here is, and we tell this to people, the sober sex, even with someone where you've healed the relationship and love them a lot, is going to be different than that intense high when you're acting out, right? And it is. I have the same message for my methamphetamine users, right? Sober sex is going to be different from that, and it's not going to be as intense, and it's not going to. Everybody jokingly or not talks about, well, how can I have meth sex without the meth? But no, what we're looking for is a different experience, and I think so. There's some grief involved. I think part of the recovery process is grieving that loss, for all the destructive elements it does to our marriages and our personalities and everything else, the havoc it creates, the unmanageability. People miss it when it goes, right? Because it was, what was it? It was a coping mechanism. It was our way of dealing with life, or rather not dealing with life. And it's not sustainable. And it's also not a healthy way to do it. So I think just learning how to, first of all, accept that it's going to be different, but that doesn't mean you're doomed to this unhappy and unfulfilling sex life. That part of the skills of recovery is learning how to do that, learning how to be intimate, learning how to be empathetic, learning how to have compassion, learning how to communicate, learning how to listen. All these skills that, like we were saying before, somehow that manual or that chapter got lost for a lot of people. So these are skills, and it's very teachable. It's very learnable. That's a word, but I think we just have to focus on and do it in recovery. It's part of our recovery skills. It's not enough just to stop acting out, right? We have to then start moving forward and learning these new skills and employing them in a way that's healing. And it takes time and patience and work. And it's not the totally hijacking, high that you get from the high super stimulants like sex or porn or amphetamines. It's just not.
so someone says, please expand on grieving. Are there exercises or practices and workbooks?
I don't know there are a lot of workbooks on grief per se. I don't know one specifically written toward addiction recovery per se, although there may be. I'm not familiar with it. We incorporate that as Seeking Integrity into our lecture system and our group work, where it really, and it's kind of almost all the clients are taken by surprise, like grief. Wow, isn't this a good riddance kind of thing if they're open to that finally? But we talk about kind of the lost and found, or I talk about the lost and found of recovery, where what are we losing? We're losing our escape valve, right? We're losing our fantasy that we dropped into when we were uncomfortable or bored or whatever. We're losing our coping mechanism. We're losing sometimes a primary relationship, right? And I know partners don't want to hear that, but sometimes that relationship with that addictive behavior is the one that people will defend and protect and keep secret, and that's the last to go sometimes. So I think there's a lot of loss, but I also point out, to counterbalance it, there's a lot of found too, right? We find stability. We sometimes find our spouse again in this. We sometimes find out who we are for the first time. We heal for the first time from trauma and other things that have driven us our whole lives. So there's a lot of things that we find as well. But I think to actually help people go through that grieving process, and there's the 5 stages, of course, that Kubler-Ross talks about that everybody's familiar with, and just to really go through that. And the end point is acceptance, and I think that's where we have to go. But there's a lot of letting go and saying goodbye. And in many cases it's good riddance, but sometimes it's a harder one to let go of, because mostly in my experience with clients, it's the losing their comfortable zone, right, where they can step into when things get too intense in their world, in their life. And what does that mean? If we shut that door and seal it off, that escape valve, then we have to deal with life, and then we have to really feel stuff and talk to our partner and listen and work at it and be uncomfortable and all these skills that addicts don't like to do. But it's again skills. We can learn all this stuff, and it's important to recognize it. And one more thing I'll say about the grief. Kubler-Ross's work was amazing, identifying the stages. If I'll remind people, I'm sure everybody's heard that she was the oncologist, right? That's just escorted a lot of people through the end of their lives and that transition process. The one thing I think is mistaken about it sometimes is we tend to think of it as linear. So we'll memorize the stages so that, the first one may be denial, then anger, then depression. Yeah, those are all, if you ever experienced grief, and who hasn't, you can identify all those things. But in my experience, it's not a linear thing. I may be angry today, then back in denial tomorrow, then an acceptance briefly, then, we bounce around. It's not a linear process. But I think to just be gentle with ourselves as we go through grief, because it's a very real thing. I think grief makes us uncomfortable in our culture, and we don't want to talk about it. And I think we at our own peril, we don't talk about it, because everybody has it. And I think it's an important part of the recovery process.
I know it is, and it is a process, and I agree that it's not linear. Debbie McCrae did a really good 2-part webinar on that. It's posted on our website, but
wonderful. Yes.
On grieving, and all the different things. And I often say to betrayed partners, you're grieving the loss of the relationship you thought you had, the partner that you thought you had. But from an addict standpoint, yes, grieving the loss of the maladaptive coping mechanism that let me navigate my life in some way. And like you talked about, that is absolutely the first layer. That's abstinence is just not doing the problematic behaviors. Learning to live life on life's terms is, what recovery is about. And while it sounds boring, to somebody who's seeking intensity, if I could wave a magic wand and you could see how good life is and what real connection and joy and meaningful, life is, you would go, oh, wait, now I get it, and would, do anything you need to do to get there. So, another Sophia Caudle on In the Rooms was doing a grief group on, In the Rooms is another recovery platform, and it's mostly chemical, but they do have a few other things. But she was doing a grief group, like a kind of like our drop-in groups on that. And there's a podcast that she did with Dr. Rob on grief as well. So any of those things, Tammy, TAMI at seekingintegrity.com. Let me know what you're looking for, and I'll try to point you towards those. But
that's good too. There's a lot more resources than I even knew, and right here. So that's beautiful, because it's an important piece of the process.
Yeah. And to not go, oh, I shouldn't be feeling this way. Like you said, be kind to yourself, with this. It's like, yeah, I identify that, you're making a decision. I forgot the Greek word, but like it's like incise or something like that. Like if you make a decision to do recovery, you are deciding not to do addiction, and there is a loss. You're cutting away something. So you're, and it can be a choice. And thank goodness, because we addicts don't want to be told. I don't want to be told what to do. I want it to be my decision, and I choose recovery. I absolutely choose recovery today, but it still is, there is, a loss of, all of those. And often it's the mistaken perceived fun, that I'm missing. I am really clear at this point that I'm not missing out on any fun. But early in recovery, like I was, I remember thinking, oh, I can't ever, I got into the always and nevers. And, so there was absolute grief of like going, no, just for today, I'm choosing this. That was a helpful tool for me, rather than I can never do this, or I'll always be,
if you get into that mindset of always, never, should, those words, it's a losing battle. Ultimately,
those are not helpful. Yes.
Yeah, totally. And I think just recognizing that it happens to everybody is really important here, because it's a choice, and we can always choose not to, but at our peril, as we talked about. So yeah.
So other questions? These are helpful questions. Any other questions for Dr. David? I try to share accurately, the things that you've taught me, like, you're 9 times more likely to relapse, and that's across the board. Going back to what we talked about with, other treatment programs, and I think one of the huge differences with Seeking Integrity is that we're looking holistically. We aren't just going, well, we're just going to talk about, your sex addiction, your porn addiction, all the, we're going to talk about this little narrow category. We're going, we have to look at your life, because we've had guys that have gambling issues or eating disorders, or whatever, that are co-occurring. And so making sure that we're looking across any problematic behavior, but then addressing those underlying issues, because just stopping, and I get this question a lot. It's like, well, I'm not doing that. I haven't done that for, X amount of time, and I'm like, great, that's called abstinence. Just not doing the problematic behaviors is basically doing what we were supposed to do in the first place, so while, we as addicts, give out chips and gold stars for all of those things, the rest of the world is going like, we don't care, so it absolutely is. How do we change, and how do we integrate recovery into how we address, all things?
You've hit on one of my pet peeves, that when I'm talking now about mostly substance treatment programs in the United States, are just, including very fine programs, the best programs, the household name programs, really refuse to recognize these behavioral addictions. So they'll do the substances, and we've had clients come through Seeking Integrity who, have years of sobriety from alcohol or drugs. But what they've done, they've just transferred the addiction. I call it whack-a-mole syndrome. And they just move right over into porn. I go to AA and NA meetings myself. I'll look around, half the room are active sex addicts, and kind of joking about it, and just kind of willfully ignorant about it too, right? They've just transferred all their compulsive behaviors to something else. And what does that do? That ultimately freezes your recovery, from my point of view. So these guys that'll come to Seeking Integrity with, I can remember one guy who had, I think, 6 or 7 years clean from alcohol and drugs, but his life was totally unmanageable. And he had in his mind sobriety. So what was the problem? Well, the problem, he had a blazing addiction to the sex and porn and other stuff in his life. So unless we treat it holistically, just like you said, Tammy, unless we treat the whole person, the whole addiction, all these behaviors, and we know, and I believe these programs in the country that are kind of willfully ignoring this, they're ignoring the science, because we have science now. We have PET scans and fMRIs that show, okay, this is how your brain lights up on cocaine. And guess what? This is how your brain lights up on porn. It's exactly the same way. It's just 2 different methods of getting that particular brain reaction, whether you're looking at porn or sexual acting out or gambling or snorting cocaine. It's the same stuff. And I think to not recognize that is not a good thing. And so I think that, again, we recognize the whole person in that sense.
Well, it's not only not a good thing, it's like, I think it's a disservice to clients. Dr. Rob talks about most, treatment programs don't address from the waist to the knees, and I'm going on with porn addiction, it's eyes and everything, whatever. But, that's just a short way of saying it. But,
True.
it's like, we have guys that have been, I think the record was 9 different treatment programs before they came to us. What a monumental waste. And how, like, I would give them credit for coming, to us and trying again, because like at some point I'd go, I give up, so I'm grateful, that he didn't, but at some point it's like, just checking out of life, trying to get the help that you need. Whatever form of addiction it is, it's a maladaptive coping mechanism. I don't know how to do life, and so I'm using something else or someone else, in order to cope. And
until we learn more healthy ways of coping, we're going to continue to look for addictive processes to soothe ourselves, right? So we maybe gets over from alcohol and cannabis, but then switch to porn or something else, or shopping or exercise or spending or whatever. So yeah. And I think, and to your point, I think this is maybe getting into the weeds on this, but I think the way we train therapists in this country, they don't get a lot of sex education or any kind of sex therapy per se. And I've done a lot of training of therapists who were excellent therapists who had total blind spots. They didn't know how to do a sexual history. They didn't want to they were uncomfortable themselves, and so they didn't want to go there, right? So maybe somebody has excessive porn use in their practice who's not even thinking about being a sex addict, but maybe they're afraid to ask about that because the therapist, I mean, because they're not comfortable talking about it with somebody. So these are the kinds of training issues that I think that therapists do not such a great job at. And so places like Seeking Integrity and CSATs and some sex therapists, not all, have that awareness and that sensitivity. Yeah, we need to go there because we're doing our clients a disservice if we kind of ignore this elephant in the room that we don't want to talk about because it makes us uncomfortable. So yeah, it's a big problem still, for sure.
Well, and even talking about training, and we've got a question too, but like I think about, people say, well, I use porn. Well, it would be important to know what that means, because
Exactly.
like there's porn for everything. So like you can't just say, because it's like I would have a concept of what porn could. Well, I probably have I've been in this field long enough. I probably have a more extensive, but like a person on the street has a general image of what they probably think, porn is, but it's really important to understand what is that person's arousal template, what are they utilizing, and how has that changed since they first started using porn? Is there an escalate? I mean, all of these things, but people don't even ask, or they just go, oh yeah, you use porn. Okay, well, everybody does. Well,
Or people say, I don't use porn. And then, but not following up, okay, what do the whole concept of not porn, right?
yeah,
The,
non-porn porn. Yeah, I use
the
that.
things that aren't explicit, but Instagram even, are you getting your little dopamine kick? Are all your friends on Instagram, young women with bikinis? And it's like that kind of thing. And they don't even connect it. But if the therapist doesn't follow up on it, or a friend or somebody, we can fool ourselves big time.
Okay, so the question, can you speak about what separation means to an addict, as my husband thinks that gives him the green light to sleep around is what it means. So if we're separated, now he has carte blanche to go like, oh, I'm a single guy apparently. So
Yeah, I'd say that's a pretty bad misinterpretation of the idea, and when I talk about separation, I always like to mention therapeutic separation, which a lot of couples in recovery do. And that, I think that has great benefits. I will say though, if just separating, there's no magic in just separating, because the idea of separating is to kind of disrupt the chaos that can come with arguing and hurt and bad feelings and stuff, and buy you time without activating each other to work on it, right? So it's just kind of quieting down so you can work on it, but just separating isn't going to do much except separate. But and separation does not mean, of course, license to act out, clearly. And so I guess what is the intention? Is the intention to kind of separate to buy time to heal the relationship, or is it a step toward divorce, or to clarify that? But I don't know if your husband is in as a therapist or CSAT, but I think to really clarify what does that mean. And it certainly does not, it's not carte blanche to go and act out, which is actually the total opposite of where we need to go, right? If anything, what I would recommend during a separation is abstinence, because it quiets down, it neutralizes that whole thing, so you can start to feel what's really going on here, and learn how to manage the impulses and the triggers and the feelings and all that. So it's really kind of the total opposite of what I'd recommend in terms of what somebody do. So that to me comes down to maybe a question of willingness. Are they, where are they at, and or even denial sometimes about what's going on. But I think separations can be really advantageous, especially if a couple has made a decision to heal the relationship and work on the relationship. Not every couple does, and that's okay. There's no right or wrong. But if you're going to go that route, then separation, I think, should be directed and have some therapeutic guidance so you can make best use of the time. Because the point is, when you come back together again, you've learned some new skills. You've quieted down some of those the waters, if you will. Not permission to act out. So that's unfortunate. Hopefully he's engaged in some kind of feedback loop, whether it's a sponsor or a therapist or peers that can help him get clarity on that.
Well, and I'm with you. I think it's always important to have a plan otherwise it's just a separation. So what is the plan? What am I looking for, from you in order to be safe so that we can, come back together? Do we want to come back together? Or like you said, is this moving, towards divorce? And, even that, it's like, at what point do we decide that, this relationship can't move forward? So, but I'm going to talk to you. Get an STD test, please. That is like, you have no control over him, but please take care of you and your body. So please get an STD test for you. I talk often about healthy boundaries, for anyone, but for partners, for your physical safety, financial safety, emotional safety, and spiritual safety. What do you need to take care of you? Clearly, like this sounds like he's in very active addiction and, and not looking at focusing on how do we value the relationship? How do we move forward? This isn't, I can't even think of a good analogy, because I don't think going to Vegas is like you get a carte blanche. You don't, like there's no, oh, I have a pass on my marital vows or something like that because we're separated. No, if you're in a relationship, and you've broken the agreements, whatever those are, then, how do we come back together?
I want to underscore something you just said, Tammy, because that it really points out the degree to which this person is still kind of in their addiction, right? I think one of the characteristics of addiction is very opportunistic. So, okay, so my wife is going to see her family for 4 days. I have the house to myself, and what does the addict's mind do? Is like it thinks, oh, I have a business trip. I'll be in a hotel for 3 days. My afternoon appointments just got canceled, and addiction fills in that void as soon as it happens. And I think, so I hear this person still thinking that way, right? Okay, I have a separation, so I can do this or that or that. And no, that's not the right answer, but that's the addict speaking. Clearly, that's an addict's voice. And so I think to really recognize that and see where that's coming from. And I totally endorse what you said, Tammy, for this person to you have a right to put down boundaries to make you feel safe. And then, this is not okay, is not okay. And you have a say in that, and what's acceptable to you. You can't control the person, but you can put down boundaries to keep yourself safe. So, yeah.
Yeah, with a formal therapeutic separation, there is a plan, and these are the things 60 days, 90 days, whatever. But it's like I'm looking to see these things and be concrete. Like here's what doesn't work. I want you to have empathy. No addict knows what that even means. You can say, I want you to show. Here are actions that would, be useful, whatever it is, and those can look like empathy to you, but a generic term that doesn't have concrete actionable things is less useful. So like, be very specific. I'm looking for you to attend your 12-step meeting. I'm looking for you to be working on the steps. I'm looking for you to be working with your qualified professional. I'm like, we have online drop-in groups. The next Sex Addiction 101 starts in January. Those are concrete things that can show I'm working on identifying, what the issues are and having a plan so that I don't keep doing those things. So, but I hear often, and I'm sure you do too, Dr. David, where people are like, we've been separated for 3 years. And I'm like, what does that mean? Like, you're separated. Like, to me, that's like, what is the plan? If there's no plan for a separation, then you're just kind of in this in-between place.
Yeah, so there's no magic about just separating, right? That's not the answer. It has to be intentional and goal driven, in my point of view, just like you said, Tammy, in very concrete ways. Because I think it's right. People, of course, partners want empathy, right, and compassion and some sense of feeling, but I think it really has to be operationalized, to put a cold kind of view on it. Just what does that look like, in concrete terms? That really makes it real. And I think for everybody, it makes it measurable, and you can see, okay, are we moving toward it or not? And I think that's a really, really important step. And we can change them, right? People can change boundaries. People can change objectives. Maybe this one doesn't fit anymore. Maybe we need to kind of refine it. Or so this is a living kind of thing. You don't be changing boundaries willy-nilly, right, all the time, but I think they're meant to be adaptive and move as things change. But I think that it protects everybody. It really lets the addict, whether they like it or not, know kind of where they stand, what they're doing, and puts the responsibility on them really to take these actions, these corrective actions, and also protects the partner by saying, okay, this is what I need, and this is what I will accept or not, and this is what's going to happen. So it puts everything in very real terms in a way that I think, like that example you mentioned, Tamara, okay, 3 years kind of slipping and sliding, and good days, bad days, but where are we going here? What's the movement? What's the trend? I think sometimes that gets lost unless there's these measurable objectives in the game plan.
And everybody gets to choose if being separated for 3 years, but still being married, but living very separate lives works for no judgment, like that is absolutely.
Of course.
But I'm always looking at we are. I often share, Dr. Rob did a podcast with Dr. Stan Tatkin called "We Do." In a healthy relationship where the two of us are you and me against the world, we are healthier. We are, the benefits are just, innumerable. In a disconnected relationship or an unhealthy relationship, we are not, and so at some point, like we're better off not being in a relationship if it's an unhealthy relationship. So at some point, for my physical health, emotional health, whatever, I need to decide what is best for me. And if it's, a roommate situation with a spouse, but we don't all good, everybody gets to pick, but, we're in the business of, we want, people to be living congruent lives and, in healthy relationships to, not perfectly, because we're human and messy. But striving for, I love that our company is called Seeking Integrity. We strive for that personally, and we want to help others have that as well. So
there's a concept in dialectical behavioral therapy, I know we're almost out of time, DBT, that I really find useful. There's a section in DBT on building compassion and empathy, and it's very relatable to sex addicts and recovery. But one of the concepts is, it's simple, but it's so powerful. It's moving, if we're going to work on this as a couple, moving from me to we, right? So It's not, I'm thinking of me, you're thinking of you. It's like, let's think as a team here. How are we acting as a we? Whether it's raising our kids or making decisions or healing us. But I think that it's a subtle shift, but it's really powerful, because now we're just at two individuals at odds. We're a we, and it reframes it in a powerful way.
And I'm going to caveat that because I agree, but it's usually the addict who like they'll be quick to go, well, we need to think of we, and so therefore you should, because no, it's like addiction is me, it's all about me, and my world is really small, and so the heavy lifting, in that equation, is on the addict, because we are so focused on hanging on to, our little behaviors that our coping skills, and we don't want to give those up, and so totally I love when we talk about like the outer circle. If we come up and look at all of these great things and how good life is, then we're like, oh, there is a we out there, but we're all, we're down me. So
right, totally.
Well, thank you, Dr. David. It was fantastic to see you. I'm so grateful for you, and we'll plan on it again. I guess we'll see you in February. So
sounds good. Great, Tammy.
All right. Bye, everyone.
Bye, everybody. Take care.